Wilkins is on his 8th year serving on our board, and he has been our chairman for the last 6, correct?
Thereabouts.
That's right. So come on up.
My point here is just to say thank you for the partnership that we have with you. It is our pleasure to do this. We love doing this. We want to do more of this. We wish we could do more of this. And the employee campaigns that we do, all the fundraising, that's our driving force, is to make that number bigger and bigger and bigger year over year. So thank you for what you do and helping us with this.
The hospital, quite honestly, is why we're able to do this. The foundation refers to the hospital as our premier sponsor in everything we do. Because they do pay 100% of our overhead. And for those of y'all in the nonprofit world, that's an incredible gift. So that 100% of the dollars that are given to us, if we get a check for $1,000, $100, 100% of it can go out into the community to do what we do. So thank y'all for being our premier sponsor. Y'all may remember the employees last year raised $302,000, and quite honestly, $107,000 of those dollars are going to y'all today. So thank y'all for making that happen. We're already working on next year's campaign, which will be the end of September. So, okay, David, I'm going to turn it over here for a minute.
All right, try not to mess it up. This is our happiest day.
I was talking last week, we had at the hospital, we had a leadership training day, and there was a healthcare professional that was in that wanted to know what the foundation did. And so that's always fun to give your little elevator speech. And she was like, wow, y'all are doing population healthcare, right? What you're doing, your mission is population healthcare. You're ahead of your time, which I had never thought of it that way. But y'all are in the trenches helping create healthier communities. So thank y'all.
Thank you so much. Jill said this is a happy day. It's certainly a happy day for Backpack Blessings, and we thank you not only for this year, but last year and the year before that, and all the ways the foundation has helped Backpack Blessings. This is actually a new program. We have about 150 high school students in our 3 high schools in Craven County who, for whatever reason, are not in the regular, go to school during the day. Many of them are at risk academically. Most of them are at risk for hunger. And they come to school either trying to catch up or trying to, redo a class that they need for graduation. They come about 2:30 and they stay till 7. And there's no child nutrition program for them. There's no food for them, and 90% of them do not come with any kind of food. So they have asked us to provide snacks for those classes. The teachers who have been buying the food out of their own pockets say it's unbelievable how much more focused and ready to learn the children are if they're not hungry during those classes. So we have a plan to provide microwaves for the schools and some substantial snacks so that they can move on toward graduation. And we thank you.
Thank you, hospital administration and the staff that work so hard to raise the money for all of these great programs serving our surrounding counties. It is such a privilege to be a part of this collaboration that helps serve families who are living with cancer in some way. And there's not a person in this room who's not affected by that in some way. So Camp Seagull and Camp Seafair provide a family camp weekend. This will be our 4th weekend, our 4th annual weekend. And what I love is we're getting to serve the same families from the area because they're getting great health care, and this is their new family tradition to come to camp and have what they call a worry-free weekend, not having to go to any appointments, and that's just worth celebrating. So thank y'all very much.
Thank you once again for supporting our agency in Colorado County. We provide nutritional support and medical assistance to victims of domestic violence and their children who come through our agency. Most of our clients have little, if any, resources when they enter our programs, so this means a lot to a lot of people. Thank you again so much.
I've been in food banking for 15 years, which is a long time in this industry. 15 years ago, if you had asked me who our partners are, I would tell you it was Food Line or Walmart or a grocery store. I am very proud that today our partners are healthcare providers. Food banking is changing. And what you're going to see is becoming the future is much more of a nutritional education aspect,
much more of a nutritional emphasis as we go forward. I would not do this if that wasn't where we were headed. I really appreciate this partnership. And it means a lot to me because I know where we're going. And this is a fantastic step. So thank you.
It's huge to Hope Clinic. What I hold in my hand, just to give you some idea, this will give medical care, lab services, referrals, medications to 50 of our patients that we see. It is 10% of our patient population. It is 10% of our budget. It is huge, and we thank you so much. It's appropriate that we go along with Hope, because we're doing pretty much the same thing, except ours is focused on breast cancer. The first grant that we got for y'all was 2014 in the fall, and 100% of that money went to provide the life-saving treatments for 48 ladies. We didn't have any men this time, but 48 ladies in the the Ford County area. We still don't have anybody from Jones, so we need somebody from Jones to help take care of. I found somebody in Jones from you. But we just thank you, and again, the same thing. You know, we're one of the bigger numbers on there too, but if we just look at that number, we could say there are 15 people who are gonna have their surgery for breast cancer that would not have it. We have 3 right now that this money is gonna pay their bills, and we'll have a little left over for some others. So again, thank you for being lifesavers, and thank you, hospital. I want to take this model back to all the other counties. I have 29 counties. The others need to learn this model, so will y'all come and do workshops for me? Yeah, this is huge.
Over 150 people on the beach last weekend. We had fantastic weather. Anytime you want to go to the beach with good weather, come down to the Mile of Hope because we always have good weather. This was our 26th year of helping children with cancer and their families. It's, like you said a few minutes ago, a getaway weekend, but what we have done for the past 27 years is, like this past year, this was 24 families newly diagnosed this year with childhood cancer. Our youngest was 4 months old, the oldest was about 18, and so there's no restrictions, there's no limitations as to location. We had a family from New Bern this year. We had 24 different towns in eastern North Carolina that had these children. So from the 3 hospitals at Duke, UNC, and East Carolina, they select these families, and we are the ones that have the most fun being able to do that. We're all volunteer organization. This money goes directly in to help each one of these families have a fantastic weekend. So next Mother's Day weekend, come to the beach. That's where we're going to be. Thank you very much.
Overwhelmed every year for this foundation. They have been such a wonderful support to us for several years, and this year we are hoping to provide equipment so that our readers can read additional papers in our listening area. We cover a 9-county area, and through this grant we hope to be able to access the Jacksonville paper easier, and we also are getting equipment to enhance our broadcast. We have readers who come to a broadcast studio each day to read the local news. And we are so grateful to CarolinaEast Foundation and Jill and her staff and the hospital. And last year this grant allowed us to provide equipment so that we can have a better broadcast in every patient room in the hospital in Craven County. And we did have an opportunity to check that out one time this year, and we know it works. We are just so indebted to this foundation. And again, thank you for allowing us to continue the purpose of our program, and that is to provide audio, local news and information to people who are unable to read printed materials in the usual manner.
I'm Juliette Rogers with RCS. I'm the executive director there. We are in the business of filling holes in this community where there are none. So there's a lot of people that come out of the hospital that have no money to pay for their prescriptions in the ER, And they come over to RCS, and we use this money to pay for their immediate emergent needs. We got new software this year, which was a big deal. Ours stopped being supported in 1990 by Microsoft. So we're actually in the 2000s, that's a big deal. But we were really able to track who was using this service. And it was amazing. The referrals are coming from the Department of Corrections, the Sheriff's Department, all of Craven County, Jones County schools are using this. Individuals are referring, churches are referring. Let's see, the behavioral health, a lot of behavioral health is being referred to get psychotropic meds. We've been taking care of our people that are in our shelter that have behavioral health issues, and they kind of come first with this. But we also have Dr. Oakley now that's coming every Wednesday to treat and write with his prescription pad and writing and helping people, emergent needs inside of our homeless shelter. And then we're also opening that up to the soup kitchen. So we're trying to fill that hole that Mercy Clinic has right now till they reorganize and get rolling. So I'm really, really grateful for this. And I can't thank you enough, but we couldn't do it without you. We also made the pledge that we're gonna match this with our general fund, so this 15 turns into 30. So thank you very much.
This is Melanie Ross, and I work at Vanceboro Farm Life Elementary School, and I'm one of the exceptional children's teachers. And we are in the process of raising funds to build an outside learning environment. We currently do not have a playground that's accessible for all of our students with disabilities, including wheelchairs, visually impaired, deaf, autism. So with this support, thank you so much, we are now at $49,000 of our $60,000 goal. So we thank you so much for the support, and we hope that by next school year we'll be able to have an outside learning environment for our students to play on. Thank you again.
To introduce two very special people. Valerie Merkler, sitting there in blue. She's our operations manager and literally my right hand. And Marielle LeRae, one of our board members. Thank you for all of your help. This money is going to go to helping women and children start their new lives, literally, by helping to pay rent and utilities, and if there's anything left over, maybe some furniture. Last fiscal year, 114 women and kids stayed in our safe house, and they literally had to rebuild their lives from the ground up. So I get really emotional about this because you're helping these families start. Thank you very much, and thank you to the foundation and the hospital. You've been such good friends for us for a long time.
Just reminded of, let's join together today to create a fabulous tomorrow. That's what it's all about, is us working together and taking care of the folks in these communities.
Thank you for being here today, and thank you for what you do for our community. We take care of the same people. We serve a lot of the same folks in the county, in the region, and it really takes a lot of people to do that. It's a team sport, no question about that. Last year at CarolinaEast Health System, we took care of almost 380,000 patients. That's a lot of folks, and it's such an honor and privilege to work with the folks that I get to work with every day, 24 hours a day, 7 days a week, 365 days a year, Christmas days, Saturdays, hurricane days, snow days, and they do an incredible job. On top of that, in addition to doing all that, they donated how much?
$302,000.
$302,000 out of their pockets, which goes to support folks like you and your mission and all the good things that you do. It's a terrific team. They do good work, as you do, and thank you for partnering with us to take care of our community. It's a great place to live, and anything that we can do to continue to make it such a great place to live is wonderful. So thank you for that. Thank you.
Thank you, Ray.